This is Radio Health Journal. I'm Nancy Benson. This week, should the U.S. join the many countries offering paid parental leave?
It's sad, but only 17% of workers here in the United States have the ability to access paid leave through their employers. And actually, even the lowest wage worker, that number goes down to 5%.
The surprising benefits of paid parental leave when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I'm not perfect. I will make mistakes, and it's okay to ask for help. Caregivers need care too.
The ups and downs of caring for a loved one. Then,
I love this country, but it's not a blind love. I do see problems.
Viewpoint speaks with one Swedish author about the global perception versus the reality of modern-day Sweden. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Most American companies have parental leave policies governing time off when an employee is having a baby. According to the law, the Family and Medical Leave Act, workers can take up to 12 weeks unpaid leave if they want. But it's the rare company that gives workers paid time off when they become new parents.
It's sad, but only 17% of workers here in the United States have the ability to access paid leave through their employers. And actually, even the lowest wage worker, that number goes down to 5%.
That's Lucy Sullivan, executive director of an organization called 1,000 Days.
The 1,000 days between a woman's pregnancy and the first 2 years of a child's life are the most important in terms of setting the foundation for lifelong health. They're also the most important time to foster healthy brain development, and a lot of brain growth and development happens in that first 1,000 days, starting early in pregnancy. So it's really critical. Our organization, 1,000 Days, works to make the health and nutrition of moms and babies here in the U.S. and around the world a policy and funding priority. And that means advocating for things like paid parental leave and health care and food assistance for vulnerable families when they need them. But paid parental leave has been a strong focus of ours from the beginning because it is critical that moms have healthy pregnancies and then time to recover from childbirth, time to breastfeed, time to bond with their children, and really paid leave is an investment in families.
Most countries make that investment. In fact, there are only 8 nations around the world that don't offer paid leave for either new moms or dads. And the United States is the only major country on that list. Sullivan says a first-of-its-kind analysis of more than 100 studies shows paid leave makes a big difference.
Paid family leave has the potential to save lives. It's really striking when you look at the data that offering paid leave to mothers and families has the potential to reduce infant mortality by as much as 10%. In one study, they found that extending paid leave to about 12 weeks here in the U.S. would save the lives of 600 babies each year. So that's really putting an important dent in our infant mortality rate here in the U.S. The other thing is that paid leave reduces the medical complications that can occur during pregnancy. It certainly reduces the risk of C-sections. So when moms have time off to go get their prenatal appointments and go seek medical care and have time if they have a complicated pregnancy for bed rest and things like that.
Sullivan says paid leave, starting late in pregnancy, can also reduce the number of preterm births and their subsequent complications and developmental difficulties. She says paid time off is a good thing for moms once they're home as well.
Paid parental leave can reduce the risk of postpartum depression and anxiety. And of course, it helps moms breastfeed. And we know how critical breastfeeding is for both the health of moms and babies. Breastfeeding can reduce a woman's risk of heart disease, which is a leading killer of women here in the U.S., as well as her risk of breast cancer and ovarian cancer. And for babies, breastfeeding is a powerful way of delivering the best nutrition to babies, and it gives babies protection against pneumonia, respiratory infection, and SIDS, or sudden infant death syndrome, which is a leading cause of infant mortality here in the U.S.
Sullivan says the studies show that both the length of time off and whether it's paid or unpaid matter in how well babies do.
In the case of the infant mortality that I talked about, there was a real strong connection between paid leave and infant mortality, but unpaid leave had actually no effect on infant mortality. So what that is telling us is that it's really important for parents to have that job-protected time off to care for their infant and to ensure that the family is financially stable. Having a baby is stressful enough, and you don't need the added worry of knowing if you're going to have your next paycheck or whether you're going to lose your job.
Sullivan says 12 weeks off is really a baseline. That's what the Family and Medical Leave Act provides for. More time off would be better, but she says 3 months is proven to carry positive effects.
That study that I referenced on infant mortality, that looked at 12 weeks of leave and how that 12 weeks of leave could reduce infant deaths by 600. But at 1,000 Days and other organizations, we think that longer is better when it comes to things like breastfeeding. 6 months is what's recommended in terms of breastfeeding, and that's what the AAP, the American Academy of Pediatrics, recommends, as well as other health organizations. So we understand that women need the time off. Breastfeeding takes energy, it takes time, it takes capacity, and so we want to make sure that women are set up to succeed and breastfeed for as long as they want to.
A few states, like California and New Jersey, have limited pay for maternity disability. However, without universal paid medical leave in the United States, most women don't come close to 6 months or even 12 weeks off.
Nearly 1 in 4 women who actually do take leave go back to work within just 2 weeks of giving birth. And that's in part because they can't afford to continue to stay home with their baby because they're not getting paid during that time off. So it's critical that there is that sort of floor in terms of financial stability and providing families with economic security. There's also some data that indicates that having this paid time off helps reduce people's reliance on government programs such as food stamps or SNAP.
Sullivan says a mother and child's well-being shouldn't be dependent on what state you live in or whether you happen to work for a good company. Many in Congress say they agree in principle about a national paid time off plan. The problem is paying for it. Sullivan says some plans call for maternity-only payments borrowed against a person's future Social Security benefits or through tax credits that have to be paid back. She prefers a plan that would tax all employers and employees to pay for a wider range of caregiving.
We have to think about paid parental leave as an investment in America's families, and it's something that other countries have figured out how to do, how to pay for, how to implement. We want to set families up to succeed, and I think that this issue affects all of us because when kids don't get a healthy start to life, we all see the consequences, and all of us at some time or another have to take time away from our jobs to care for a loved one or care for ourselves.
You can find out more about the organization 1,000 Days through its website, 1000days.org. You can learn more about all our guests through links on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
If you or someone you know is struggling with addiction, please call this toll-free number right now, 800-279-0419. That's 800-279-0419. By calling your addiction team, you're taking the first steps to recovery. Don't fight addiction alone. Their advisors are ready to take your call. Your future is still a bright place. The help you need could be one call away. 800-279-0419. That's 800-279-0419. This call is completely confidential, and if you have private insurance, there could be little to no cost to you. Even if you've already been to treatment, give us a call. There's no need to let addiction ruin your life. Take the first step now. Call your addiction team at 800-279-0419. That's 800-279-0419. Make the free call now. 800-279-0419. Your addiction team is a third-party advertiser for various treatment centers and placement networks. Individual results will vary. Visit youraddictionteam.com/terms for more information.
Paid non-attorney spokesperson paid for by the Sentinel Group. Attention military vets and current soldiers who served between 2002 to 2016. Have you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces? You may be entitled to compensation. 3M, the manufacturer of earplugs made for combat, recently paid the government $9.1 million to settle a False Claims Act case for knowingly selling these defective earplugs for over a decade. Specifically, the United States argued that the manufacturer knew their earplugs were too short for proper insertion into users' ears, and that the earplugs could loosen and therefore didn't perform properly or reduce noise the way they should have. If you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces, you need to choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call the Sentinel Group now for more information and a free case review. Call 800-655-6458. 800-655-6458. That's 800-655-6458.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.
Coming up next week on Radio Health Journal.
It appears somewhat more likely than the general population, but it's not the majority of causes. And if we just look for mental illness, we'll miss the majority of mass violence.
Is mental illness the biggest cause of mass violence?
Then the secret CIA project called MK Ultra and its pursuit of mind control.
How much evil can you do in a good cause before the evil starts to outweigh the good?
All that and more on Radio Health Journal.